Alright, today we're going to get started on chapter 4 in your textbook. This is the cancer chapter. We're going to start, I want to look at the introduction. Make sure you pay close attention to all the terminology in this chapter. Starting with the introduction, you have malignancy. This means a cancer. Malignancy is cancer. When something's malignant, it's considered to be cancerous. Let's start with talking about neoplasia on your PowerPoint. And neoplasia means a new growth, an uncontrolled growth of cells. And like I said, malignant is rapidly dividing cells and is considered cancerous. And benign means non-cancerous. And then you also have a term that don't know if it's in your book, I don't think it is, but it's called in situ. And that's IN and then situ, SITU. This means that cancer is encapsulated, so make sure you remember that as well. Table 4.1 in your textbook has the classification of tumors. You don't really have to know that, so you can just kind of mark that out as of right now. Then you have table 4.2. This is a really good little cheat sheet table, I guess you would say, of what are benign tumors and what tumors are malignant in the epithelial tissue and the connective tissue. So look over those really good. So let's talk about the characteristics of benign tumors. These are classified by where they originate at. And they're encapsulated with clearly defined edges. They do not metastasize, and metastasize means spreading to other organs or other tissues of the body. And then they're differentiated, meaning they resemble the tissue from which it grew, the tumor grew. Cancer statistics, we don't really have to know that, but I do want you to know that cancer is the #1 leading cause of death worldwide. That is a very important statistic there. Let's see. Let's look at cancer progression. You have progression, promotion, initiation, and then transformation. Those are your 4 stages of cancer progression. And this is what happens when a regular cell becomes a cancerous cell. Okay, so it starts with progression, then promotion, then initiation, and then transformation. Let's see. Let's talk about the biology of cancer. Carcinogenesis. This is a term meaning where the tumor originated at. Genesis, think about the first book of the Bible, so the beginning, where did it first appear? Mutation, all kind of things can mutate, like the flu, influenza. It has there's hundreds and thousands of different mutations of almost every type of disease. Then you have oncogene there. Then you have tumor suppressor genes and DNA repair genes. So we're going to get into these a little bit more. Epidemiology, make sure you look over that term. Let's see, we're on page 60 here. Epidemiology is population-based study, basically. And then if we have an endogenous cancer, that means it's like a genetic cancer. Then we can have environmental cancers, and this can be from different things, mainly tobacco. Then you have chemicals, pollution, diet, alcohol, chronic infections, and then you can have medicinal carcinogens. And again, a carcinogen is something that causes cancer. Let's go on and look at the classification of cancer. I don't think that this part is in your book, so the PowerPoint's not quite lining up. But the classification of cancer, you have a tumor. Just because we say tumor, that does not mean that it is cancerous. A tumor is just a growth. And then we have neoplasia, which can be benign or malignant. And if it's malignant, remember it does mean cancerous, and it can metastasize, or it can have metastasis, which means that it's capable of spreading to nearby organs. Carcinomas, the different types of cancers. We have carcinomas. These are skin-based, like basal cell carcinomas. We have sarcomas, and these are connective tissue-based. We have mixed cancer, and this could be a mixture of epithelial and connective tissues, which are sarcomas. We have lymphomas, and this is a cancer of lymphoid tissues. We have leukemia, which is a cancer of the white blood cells. And then we have melanoma, which is a cancer of the melanin, which is also considered a type of skin cancer and is the most deadly type of skin cancer. Going on, let's look at the non-specific warning signs of cancer. This is really important. Patients that may have cancer are going to notice a change in their bowel habits, a change in their bladder habits. They may have trouble going to the restroom, or they may have excessive diarrhea. They may have trouble urinating, or they could have excessive urinary output. A sore that doesn't heal is a big indication of some type of epithelial cancer. Unusual bleeding or discharge, definite sign. Thickening or lump in the breast or any other part of the body. Indigestion or difficulty swallowing. An obvious change in a wart or a mole is a big indicator for skin cancer. A nagging cough or hoarseness. And all of these are from the American Cancer Society, the most common warning signs of cancer. Unexplained weight loss is another one there. So let's go into lung cancer. A lot of this chapter talks about the different types of cancers that you're going to see. So we're on page 62, and I'm not going to talk thoroughly about these because you do need to read your book, but lung cancer is the most common malignant disease, and usually it can be the primary site of cancer, but usually it's one of those cancers that a different cancer metastasizes to. Like if somebody has ovarian cancer or colon cancer, it may metastasize to the lungs, and usually when it does that, it can be very deadly. Obviously, the most common cause of lung cancer is smoking, and secondhand smoke as well. Symptoms for lung cancer, usually there's not going to be any, but when the cancer does build up, you have more cancer cells, you'll notice some coughing, hoarseness, shortness of breath, blood when you cough up your sputum, you may have blood in it, loss of appetite. So those are some of your symptoms there. Let's see. To diagnose lung cancer, you have to have a biopsy is the most definitive. You can also have a sputum culture. You can have CAT scan, PET scan, a bronchoscopy, but biopsy is really the definitive answer there. Treatment, we really can do radiation for early tumors, and then more advanced stages we may be combine chemo and radiation. Let's see. Let's go on to breast cancer on page 63. Breast cancer, of course, is very common, and it's the most frequent cancer in women. So the earliest sign of breast cancer is usually some kind of lump that feels abnormal. That's why we always push for women to do monthly self-breast exam. The best time to do it is in the shower. Some less common symptoms may be skin changes. It may have like an orange peel appearance on the skin. You may have some swelling, distortion, tenderness, skin irritation, nipple changes, and that includes sunken in nipples or retracted nipples, basically. The most common reason for breast cancer is a family history, but you can also, being a female, gender obviously is going to be more common in females. Your age, as we age, we're going to get more, it's going to be more common for us to develop cancer. A menstrual history, we would look at that. Oral contraceptive use can cause breast cancer. Never having children can cause cancer. Or even having a child after the age of 30 can also cause breast cancer. So there's several things that you have to look at here. The diagnosis, usually we're going to do a biopsy. Again, the biopsy is the definitive diagnosis for every type of cancer. But usually, women will do a mammogram every 1 to 2 years, breast ultrasound, maybe a fine needle aspiration as well. Let's see, treatment depends on what stage and what size the cancer is in. Surgical treatment, we may do a lumpectomy. A lot of people are not doing that anymore though, because they would just rather have the whole breast removed than do a lumpectomy, because it does frequently come back. And it can get into the axillary and the armpit and the lymph nodes, and that's how it spreads very fast when it does that. Other things we can do are radiation therapy. Again, you can have the breast removed, a mastectomy or bilateral mastectomy. We can have hormone therapy, chemo, biological therapy, and radiation mixtures. Let's go on to stomach cancer. Page 63, excuse me for 1 second. Okay, sorry about that. Stomach cancer is the 4th most common malignancy in the United States, or in the world actually. Dietary risk factors are going to be your main thing with stomach cancer. So an inadequate intake of fresh fruits and vegetables, high salt intake, consumption of smoked meats like smoked ham, or cured meats as well, and cured or smoked fish can also increase the risk for stomach cancer. An infection, you can also have an infection that's called the Helicobacter pylori virus, and we also call this H. pylori. There's a test, a very simple test to check to see if this is, if you've had this condition or you've ever had that condition. But this can cause cell destruction later on. It may not happen immediately, but it can increase your risk factors for stomach cancer. Signs and symptoms, these are usually asymptomatic at first, and then we'll start noticing obviously bowel changes, not being able to go to the restroom. We may have mild pain in the upper abdomen, so we may confuse that with indigestion. Fatigue, loss of appetite, loss of energy. So those are all some of the symptoms of stomach cancer. Again, the definitive diagnosis for this is biopsy, but we can also do CAT scan and MRI, ultrasound. The treatment is going to be surgery. We want to try to remove the cancer, remove part of the colon if we can, and then radiation therapy is really useful for any kind of stomach cancer. Then colorectal cancer, I kind of went into this with stomach cancer because usually they kind of go simultaneously. These are the most common in Western societies because we, here in the United States, we eat more high-fat foods, more high-fat meat. We have a lot of preservatives in our food, refined carbs, animal proteins, and then we have a low sedentary life. And sedentary means we don't really exercise a lot. So we have low physical activity. And so that's why we are more common to have colorectal cancer. The best prevention for this is screening every 5 years once you get to be a certain age. And then, even when you start at 21, the doctor may, for females especially, the doctor may want to do what we call a Hemoccult test to test if there's blood in the stool. And so a colonoscopy, again, is where they can go. It's done every 5 years unless you're more at risk, and it can be done at whatever your doctor says. But colonoscopy is a visual inspection of the entire colon all the way up to, all the way down to the rectum. Let's see. Risk factors for colon cancer are going to be obesity, high-fat diet, smoking, low physical activity, heavy alcohol intake, diet in high in red meat and processed meats, and a diet low in fruits and veggies. surgery and chemo is really the best prevention, or the best treatment for this. Okay, let's go into liver cancer on page 65. Liver cancer is not too common. This is one of those cancers that usually other cancers metastasize to the liver. So it is the second most common metastatic cancer. So common symptoms for liver cancer are going to be abdominal pain. The main symptom here is called, or the main sign here is going to be a condition called ascites, and this is where there's fluid in the abdominal cavity. Excuse me. Some symptoms: you're going to have anorexia, meaning you're not wanting to eat. Loss of appetite. Let's say hepatomegaly, enlargement of the liver. Jaundice, which is a yellowing of the skin. So those are your most common symptoms. You have usually a 10% survival rate for this. And again, definitive diagnosis is a biopsy, or you can do a CAT scan as well. Treatment for this depends on the person's age, the margins of the tumors, because they don't really react well to chemo or radiation. Let's see. Let's go on to cervical cancer, bottom of page 65. This is a very common cancer, mainly caused by the HPV, which is the human papillomavirus, and almost probably 1 out of every 2 women in the U.S. have HPV, and you may not even know it. So it is the second most common cancer in women. The way you can get HPV, you can be exposed to it one time, but obviously you're going to increase your exposure by having multiple sexual partners. Early onset of sexual activity, early onset of menstruation. Genital warts is also caused by the HPV virus too. Obviously, the best way to test for this is the Pap smear. The Papa-Nicolau smear is what it's called, the whole name for it. And then we can do what we call a colposcopy, where we go in, the doctor puts different dyes on the cervix, and they can see any abnormalities, and they can biopsy it. Let's see. Usually what we can do is cryosurgery, which is freezing off the cancerous cells, and if that's not enough, we can do a LEEP procedure, or we can do a cone biopsy, which removes like a cone portion of the cervix, and you have to be put to sleep for that. And we treat cancer with radiation and chemo. Going on to uterine cancer. Uterine cancer is the 7th most common cancer in women. Uterine cancer usually occurs in middle-aged women. Their 50s and 60s is when it will have an onset. People that have never been pregnant, women in late menopause, people that are on oral estrogen therapy, removal of the ovaries, these are all increased chances for endometrial cancer or uterine cancer. This disease is also associated with diabetes, obesity, and high blood pressure. The most common sign is metrorrhagia, which is uterine bleeding after menopause. Then you may have dysuria, difficult urination, constipation, bloating, any kind of mass in the lower abdomen are all signs and symptoms of this. What we can do for here is a hysteroscopy to look into the uterus. We can do a biopsy from that and get your definitive diagnosis. For treatment, we're going to remove the uterus or do a total hysterectomy, and that includes removal of the uterus, the fallopian tubes, the cervix, and the ovaries. And that is really the best treatment for this type of cancer. We can also have radiation following surgery just to make sure that it hasn't spread anywhere. Let's see. Signs and symptoms of this, usually there's not going to be any symptoms early on, and then when we get more in the advanced stages, that's when we become sick. And then that leads on to ovarian cancer, which is the most deadly female cancer in the world. For ovarian cancer, family history is the most common cause of this. Cancer of the ovaries is influenced by hormones, reproductive factors, like if you've never been pregnant, never had a child, a prior history of breast cancer, a prior history of cervical cancer, if you have polycystic ovary syndrome. These can all put you at risk for ovarian cancer. Symptoms include discomfort in the lower abdomen. You may have abnormal bleeding. You may have GI upset or UTIs, urinary tract infections, frequently as well. The best way to detect this is to do ultrasound, and we're going to look and see if there's a tumor on the ovary, and if there is, we'll biopsy it, and then we can use chemo for the treatment. And then, of course, we'd probably do a total hysterectomy, or at least a removal of the ovaries, which is called a oophorectomy. Going on to prostate cancer, going into the male cancers now. This is the third most common cancer in men. Age is the main risk factor here. Diet is also another risk factor. Let's see, symptoms for this: urinary hesitancy, frequency, urinary urgency, urinary dribbling, a weak urine stream, blood in the urine, pain in the lower abdomen. So this does have some pretty good symptoms that will make the patient aware that there's something going wrong. The most common way to detect prostate cancer is with a PSA. Now, things are changing with this, and I'm not sure what the most common verdict is as of now, but I know they're talking about not doing the PSA until a certain age, or increasing the age. I can't remember what has been said, but a PSA is the most common test, and then of course if it comes back abnormal, we can do a biopsy. For treatment, we want to remove the prostate gland and then combine it with radiation. Testicular cancer, bottom of page 67. This is a fairly common cancer, and it can occur in any age, and usually men in their 30s and 40s are the most at risk, but it can occur at any age, even in the 20s. The most common cause for testicular cancer is environmental causes. Risk factors like a history of undescended testicles, family history of testicular cancer, and usually if you do monthly testicular exams, you may find a lump in the testes, and it's usually not painful at all, but you definitely want to get that checked out. So treatment here is to have chemo and radiation. And let's see, let's go on to esophageal cancer, page 68. This is the 6th most frequent cancer worldwide. Symptoms of this is going to be anything with swallowing, so you're going to have difficulty swallowing. You may not have a loss of appetite, not want to eat or drink, or painful eating and drinking, weight loss, a hoarseness, bleeding from the throat. So all of these are signs and symptoms of esophageal disease, or esophageal cancer, excuse me. Diagnosis, of course, is going to be with a biopsy, but we can also have a CAT scan or an endoscope test to look down the esophagus to see if there's any abnormal lesions. The treatment for this is going to be surgical removal of the esophagus, and then we're going to combine that with radiation and chemo. Usually, just so you know, that esophageal cancer is rarely curable, so the death rate is pretty high for that. Going on to bladder cancer, this is the 9th most common cancer worldwide. Risk factor for this, the big risk factor for bladder cancer is smoking, cigarette smoking. This accounts for 65% of all cases. Other factors may be environmental, like exposure to industrial chemicals, let's see what else. The most common symptom of bladder cancer is going to be blood in the urine, which we call hematuria. We can do surgery, but usually we have to combine radiation and chemo to really try to rid the cancer cells in the bladder. The survival rate is not very good, maybe a 5-year survival. Going on to head and neck cancer on page 69. This is the 11th most common cancer worldwide. And it's higher in men than women. The main risk factors here are cigarette smoking and alcohol consumption. Symptoms, you're going to have pain within the mouth, bleeding, you may have belching, difficulty swallowing, difficulty chewing, difficulty with speech, and then you may have pain around the lymph nodes in the neck. There's not really any screening tests for this, so dentists are usually the ones that find the ones that are in the mouth or around the mouth area. Radiation therapy is and chemo are usually the main causes for this, and then removing the tumor if possible. Okay, going on to lymphoma. This is there's two parts of lymphoma. We have either Hodgkin's disease or non-Hodgkin's lymphoma. Okay, so Hodgkin's disease is a malignant lymphoma. Non-Hodgkin's, I don't believe, is malignant. And the way you can tell Hodgkin's disease from non-Hodgkin's is a large cell called the Reed-Sternberg cell. The Reed-Sternberg cell that we'll see with that. This Hodgkin's disease is more common in younger adults and with people that are infected with HIV as well, and people that have been exposed long-term to wood or wood products. The most common symptom for Hodgkin's disease is painful swelling of the lymph nodes, and that could be in the neck, the groin, the armpits, behind the knee, anywhere where there's lymph nodes. You can have swelling there. Hodgkin's disease is usually treated with chemo. Usually there's a 5-year survival rate depending on the staging of this cancer. And then going on to non-Hodgkin's, patients with HIV and AIDS are the most common to have non-Hodgkin's. Anybody that has immunosuppressive therapy, they will be more likely to develop this. Let's see. The most common symptom of non-Hodgkin's lymphoma is the swelling of the lymph nodes, but there won't be any pain associated with it, just swelling. Diagnosis, we're going to do x-ray, CAT scan, you can do MRI, bone marrow sampling, and lymphograms are usually, the definitive diagnostic tool here. Non-Hodgkin's lymphoma we're going to treat with radiation and chemo combined, and this can be done over several years or more than, it can be done over many years. And usually to keep it, if it does reoccur, we may do a bone marrow transplant to try to cure the patient of this condition. Okay, going on to leukemia. On page 70, leukemia is cancer of the white blood cells, and basically you're going to have a large amount of abnormal leukocytes here. So the liver and the spleen are going to be affected here. They will become really enlarged. You'll have some symptoms dealing with that. Those are all some symptoms of leukemia. The cause of leukemia is not really known, but it could be due to a virus or exposure to radiation. Let's see. Some of the other symptoms you may have are fever, swollen lymph nodes, which is also called lymphadenopathy. Patients will complain of joint pain, abdominal pain, abnormal bleeding, weight loss. Anemia is a big sign right there, low blood cell count, but anemia is a low red blood cell count. So anemia is a big sign there. Let's see. Types of leukemia. We have the myeloid leukemia that originates in the bone marrow. Then we have the lymphoid leukemia, and this is found in the bone marrow and the lymph nodes. And then we have the acute lymphocytic leukemia, and this is the most common leukemia that's formed in children, and it usually happens very quickly and progresses very rapidly, and so you have to be very strong with treatment. Let's go on to pancreatic cancer. This is the 14th most common cause cancer worldwide, and this is the most deadly cancer. Usually everyone that has pancreatic cancer will die pretty rapidly. People that have low fiber diets, high consumption of fats and fatty meats like red meats are going to be the most common to have this condition. Some of the things that will clue you in of possible pancreatic cancer is going to be rapid weight loss, nausea, vomiting, diarrhea, weakness and fatigue, upper abdominal pain, and you may have some yellowing of the skin. How we're going to diagnose this is obviously a biopsy, but we can have an ultrasound and a CAT scan to see if this is spread anywhere else, because it will metastasize very rapidly. The only treatment we really do for this is palliative treatment, chemo to keep them alive a little longer, try to make them feel better. We're going to give them pain medicines like opioids or something of that nature to help. Alright, going on to melanoma. Melanoma is a very deadly cancer, and it's a malignant proliferation of the of melanin, which is produced in which causes your pigment color. This happens more in white people than African American people. The risk factor is going to be long-term exposure to the sun, sensitivity to sunlight, exposure to certain chemicals like tar, arsenic, radium, and any kind of past history of skin cancer will make you more prone to have melanoma. These can occur anywhere on the body. Usually they are going to appear on the back, but in women they're going to appear on the legs and maybe even the chest area. So the warning signs is going to be, just to look for moles that could change, the irregular border, a weird color, the diameter of a mole, or any type of lesion is what you want to look for melanoma. Diagnosis, the definitive diagnosis again is biopsy for this, and usually we want to do radiation combined. Okay, let's go on to thyroid cancer. Obviously this is cancer of the thyroid gland, and it's very rare. This can happen from iodine deficiency, radiation exposure. Let's see, thyroid cancer grows very slowly and is usually cured by removal of the thyroid gland, and it won't come back. Thyroid cancer usually has no symptoms. The main thing that we may have is like a nodule on the thyroid. We may have some hoarseness, some painful abdominal cramps, trouble swallowing. Those are going to be your big things. Definitive diagnosis is a biopsy with this. Kidney cancer. Going on to kidney cancer, bottom of page 71. This is the most common type of kidney cancer is a renal carcinoma, and this occurs more in men than women, and it's the 15th most common cancer worldwide. Again, just like bladder cancer, kidney cancer is going to be caused from smokers, so cigarette smoking, also obesity, especially in women, leather tanners, shoe workers, dry cleaning employees, all of these have an increased risk. And then people that have been exposed to asbestos is going to be increased risk. Commonly, there's usually no symptoms at first, but then we may have blood in the urine, we may have pain. The PowerPoint says flank pain, that means the sides. Palpable kidney mass as well. The thing we can do here is an IVP. This is an intravenous pyelogram, and we can see how the kidneys are filtering, and it'll be able to pick up any kind of nodules. Surgery obviously is going to be the most common thing here. And we may have to, eventually have dialysis as a treatment for this. Going on to cancers of the nervous system, trying to get through here pretty fast. Cancer of the nervous system is very rare, but they can happen. Brain tumors are usually caused in childhood, between 3 and 12 years old, and then the second group is in elderly people between 60 and 70 years of age. With childhood brain tumors, they think that it's caused by a cell cycle control mechanism that happens during fetal development. So there's no non-cause definitely right now, but they think that it's caused while the fetus is developing. Signs and symptoms, we may have paresis or paralysis, speech disturbances, personality changes, some even may have seizures as well. Pediatric cancers, we've kind of talked about this going through, so I'm not going to talk about it a whole lot. Let's talk about cancer with aging, and we've kind of talked about the elderly as well, so I'm not going to talk about it a whole lot, but the most common cancers in the elderly are going to be your prostate, your bladder, your kidney, lung, pancreas, and breast are going to be your most common cancers with age. So, screening recommendations for every type of cancer. You want to have MRIs, tumor markers, endoscopies, ultrasounds, biopsies, and then how we stage cancer is called the TNM system. T is for the original tumor, the N is for the lymph nodes, and then the M is metastasis. And then we have the stages 1, 2, 3, and 4. 1 is the initial phase, and stage 4 is end stage cancer. Cancer treatment, we want to, preventative measures always. Screenings, stay on your yearly screenings or however frequently your doctor says. Chemotherapy, radiation therapy, and surgery are your most common treatments. We've already talked about box 4.1, but look over that really good in your text. And then we've already talked about preventative measures as well, and the signs of cancer. So that concludes this chapter. Look over it thoroughly. There is a lot of information.